Hi, my name is Amanda Hum, and this is Veterinary 122 Radiography. The avian species is what we are taking radiographs of today. So to start off with radiographing, we measure a bird. You're not actually going to measure the bird itself. There are actually set settings on your machine, and ours is digital, so ours automatically, you put in the species and it'll automatically set it for you. However, there are larger versus smaller birds. So you may have to adjust it so you can measure if need be. When you measure, be aware that birds have a lot thinner bones, tubular bones, more ossification within their bones, and they have less calcium. So it makes for more radiolucent x-rays. You do want to have a higher MAS, so the seconds will be shorter. The KVP should be lower. We do recommend a non-grid technique, and you do a top method, cassette on the x-ray machine. So you use a cassette and place the patient on top of plexiglass or something like that on top of the cassette. However, our clinic, like I said, is digital, so we do not have the option of using a cassette. So it's already set to tabletop method when we put the avian species in. There are 3 types of restraint used for avians. One is chemical, the second is manual, the third is physical restraint. Chemical restraint is when you actually use either usually an inhalant anesthetic or an injectable anesthetic. Inhalant is usually sevoflurane or isoflurane. The injectable is usually ketamine, and it's usually dosed at 20 mg per kg to 40 mg per kg. Second option is manual restraint, which is just that, when an assistant or technician will actually physically hold the patient down with the proper gear on, the thyroid shield, x-ray badge, lead apron, and lead gloves. You want to make sure you have the lead gloves on because you don't want your hands to get extra scatter radiation exposure. The third option is physical restraint, which would be the use of some different tools. You do have glass, sandbags, tie gauze, rope, and radiolucent tape. The big side effects are, with chemical restraint, ketamine has a longer residual side effects when waking up. It's a lot more difficult for them. And then when you use certain tools, you may need to increase, like with plexiglass, the KVP needs to be increased 2 to 4. And also with things like the adhesive tape, you need to be careful because it can rip and tear the skin and the wings, the feathers on the wings. You do want to not fast any longer than 4 hours prior to doing any surgery or GI contrast study. The 4 different types of studies and views you can do are whole body lateral, whole body ventral dorsal, the caudocranial wing view, and the GI contrast study. The whole body lateral is you prefer to place on the right side. You pull the wings back, caudal to the body. You can have them in the view if you would like. They do not need to be in. The second option is the whole body ventral dorsal view, which we would lay them on their backs, wings open, expanded, so you can see that the sternum is completely over the spine. Big problem with that is larger birds do have the tendency to asphyxiate a lot quicker and stress themselves out and can suffocate. The third option is the caudocranial wing view. If you need to get a visual of the wings, to pull them back and make sure they are somewhat separate and not overlapping one another so that you can get a view of each of the wings. The GI contrast study can also be done. You can place lateral or ventral dorsal or both throughout the period. It can take anywhere from 30 minutes to 240 minutes to start from basically the mouth to the coagula. When you do have to tape down for any reason, for whether they're being sedated or not, if you need proper positioning, you would start with the head and the torso, then to the wings, then to the feet. You need to be careful because they can pull their bodies off if you do not do it in that order. I have read where birds will pull their bodies off of their wings because they're so stressed out. So keeping that in mind, you do want to make sure that if you have this patient stated you don't need to be in the field of view for the x-ray, you can stand on behind some kind of border. Our bird that we use today is a dove. She was very disgruntled and not want to be in the video for us. However, we did try and hold her down with the least stressful manner with a manual restraint. chemical restraint would be the best option. However, it was not our option today. It is recommended to do anesthesia or some kind of light sedative, usually with a mask. This helps. So we would put that information into our x-ray machine. Again, the KVP will be a little lower, the MAS will be a little bit higher. So we would actually lay down. So she is breathing heavily. As soon as I let her go, she's probably going to try and fly away. But, yeah. So one way would be to laterally place her. And to, good girl, and to lift the wings up. Again, so if I pulled both wings up, later laterally, ideally pull her legs back. As you can see, she's going to try and fly away. You can also see her fly away. This is the radiograph of what a proper VD positioning view of an avian species would be.